Good afternoon. Let me call to order the Health and Human Service and Aging Committee, Wednesday, November 1st, currently 1:05 p.m. Madam Clerk, if we can have a roll call, please.
As a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll for Ms. Conwell.
Present.
Mr. Sweeney.
Present.
Ms. Stevens. Ms. Stevens is absent at the moment. Ms. Turner.
Present.
Mr. Miller.
Present.
You have a quorum.
Right. Madam Clerk, has anyone signed in for public comment?
No, Madam Chair, no one has signed in.
All right. Before us are the minutes from the October 18th meeting. Can I have a motion and a second?
So moved. Second.
Moved by Sweeney, seconded by Turner. All in favor, please say aye.
Aye.
Right. We have several matters that are referred to the committee today. They look like they're all ARPA applications. Please, when you come up to the podium, state your name for the record, because we do have live streaming going on. Also, ARPA applications, there was a decision made by council that each application will go 3 readings. So just to let you know that. It will go through committee. Hopefully, it will be passed from committee. It will go to the council of the whole, and there'll be 3 readings from that. And I don't have that date in my mind to tell you when it should have the final process, and you're more than welcome to come back at that time to see what the council of the whole vote is.
We're looking at November 28th.
Thank you. My colleagues got my back. So November 28th, you're welcome back. Madam Clerk, if you could read the first item into the record.
Resolution 2023-0296, awarding a total sum not to exceed $11,400 to the Cleveland Treatment Center for the theatrical production of Fragmented, A Family's Toil Through Trying Times, from the District 3 ARPA Community Grant Fund.
Please come up to the podium.
My name is Elsie Collins. I'm the Executive Director of Cleveland Treatment Center.
Excuse me, could you speak into the microphone, please? Thank you.
Which button?
Yeah,
Green.
Did that work?
If it's green, you're good.
Okay. Yes.
Very good.
Good afternoon, Council. My name is Elsie Collins. I'm Executive Director of Cleveland Treatment Center. We've been around since, as you guys know, 1971. We're primary MAT, methadone, or medically assisted treatment program, but we've used the art since 1989 to do community awareness and social awareness events. At this time, started with Prester in 1989 when I worked at the City Health Department. And this is one of the plays that we did for the Ohio Commission on Minority Health. So I'd like to introduce Mr. Pickett.
Good afternoon. I'm Prester Pickett, and working with the Cleveland Treatment Center as a Cleveland area, Cuyahoga County playwright. With this project grew out of an engagement where Governor DeWine met at the 4th District, and we were in the good company of Councilman Sweeney and Mayor Justin Bibb. It advanced with an awareness that there was a need for a fiscal agency to manage the funds and to even apply for the funds. So I was able to ask the kind favor of Lynn Collins, director of the Cleveland Treatment Center here, if he would advance this process so that we could produce a stage play that presented the discussions about gun and gang violence, teenage pregnancy, and all the other issues that our senior citizens face and are challenged with often and become fearful when there are discussions about gang violence and gun violence occurring in their areas. Originally, this play was produced in 1991 at the University of Akron with the Ohio Arts Council, and it fully developed as a stage play at Strosacker Auditorium at Case Western Reserve University. I am the first African American to acquire an MFA in acting from Case Western Reserve University, so I'm proud that our institution, my alma mater, holds the honor of saying that they are able to still stay connected with something they invested in years ago. It's been produced at Cleveland State University as well in 1997 at the Henry Stambaugh Auditorium in Youngstown, Ohio. with production as well occurring at Grafton Correctional Institution when I was doing work there for the Prison Media Literacy Project to help those who were incarcerated to understand their ability to utilize the arts to address social issues. My background also includes being the individual who was acknowledged as 3 of the bicentennial playwrights, and I've been the coordinator of the Howard A. Mims African American Cultural Center at Cleveland State University for the past 27 years. However, this event, this stage play, is independent of them, and I'm only able to announce my status as a professor and coordinator there. There have been successful productions that I have had produced across the nation. My wife and I have also toured Italy with productions, and we look forward to adding the honor of being able to produce this piece, Fragmented, A Family's Toil Through Trying Times, again in partnership with the Cleveland Treatment Center. I was able to just leave the 3rd District and able to acquire their support with that being one of the locations for rehearsal space. We are also looking forward to rehearsing at the Cleveland Treatment Center, as well as other libraries, particularly with the interest of Cuyahoga County, thinking that we would be able to secure the Cuyahoga County Library to advance with some rehearsals and discussions with several community members. In closing, the piece would be produced at Mount Sinai Friendship United Church at 7510 Woodland Avenue, with 4 performances. We're also very inviting and welcoming of our community to attend any of the rehearsals, as well as, again, with your support, the productions, which would be offered to them free and open to the public. However, there is a registration required and able to offer the first come, first served seating arrangement, looking at servicing a minimum of 300 of our community members. Thank you, and I can respond to questions at this time or receive other feedback from Director Lynn Collins.
This is just awesome. You've blown me away. Council members, any questions? Councilman Sweeney.
Thank you, Madam Chairwoman. I was impressed just meeting you. Now I'm blown away you got a presentation like nobody else. My thoughts, how the genesis of this, I meet them at the 4th District. Governor DeWine's coming in hard with the state patrol. Our sheriff's there, our mayor's there, our council president's there. We're gonna get these guns off the street. We're coming in hard. We're gonna do a good job. And then I met Mr. Pickett. He says, we need to get these guns off the streets, reduce this crime. And I'm gonna do it soft. I'm gonna do it in a way that people are gonna understand it and get the folks that don't respond to hard. And then I said, how can I help? And then his modest request came in, and I'm kind of speechless right now because I know you in a different way, just quiet and timid and just adorable. But right now, I'm a bad astronaut here, and I take my stuff serious. So I look forward. Show me how to register. I won't mind. I don't need a front row seat. I need somewhere in the middle back, but I want to enjoy it and be impacted by it. So that's my soapbox, Madam Chairwoman, and that's the genesis of this request, and I'd ask my colleagues to support it.
All right, before you leave, can you give the clerk the dates of where the rehearsals will be, where the actual, so I take it these will be free tickets for the community, and did you say Mount Sinai Church?
Mount Sinai Baptist Church, formerly now known as Mount Sinai Friendship United Church.
What's the pastor's name? Is that
7510
Matthews?
Pastor Matthews, his wife, and his son.
Madam Chair.
Yes, Councilwoman.
Hello, couple questions for you. How many jobs will be created or retained as a result of this effort? What is the total cost of the project? And then talk to me about your post-performance efforts. What are you hoping to accomplish? Who are you targeting? How will you know that you made an impact?
Yes, thank you for that question. The opportunity to say that in addition to the performance, there is scheduled to be a post-performance talk back at the end of each performance, scheduled to start on December 2nd at 3 p.m. with the first opening matinee, an evening performance at 6 o'clock, and then following that Sunday with another 3 p.m. and 6 p.m. performance. With the performances, there are also the interest of having information tables so that our community members are able to acquire information, in addition to the efforts of edutainment developing in Cleveland, Ohio with the Cleveland Treatment Center. Mr. Collins has incorporated in the interest of producing this piece a survey that would allow us to document and present qualitative and quantitative data in terms of the impact based on audience response. There is the employment of the 6 main actors who are scheduled to perform for 3 of the 4 performances, and they are needing to be understudied with another acting team of another 6 actors to be employed through the funds received here. I am employed through the funds, as well as the staff at the church that is servicing us with the facility, thinking that the security is being serviced with employment opportunities through this grant. The additional discussion is that we would receive in-kind contributions from all of those who would be speakers on the panels. My last play we had produced at Case Western Reserve University through their Focus Initiative, and actually the mayor's mother was one of our panelists among so many other distinguished professionals, from professors who are interested in the topic to community members to those who provide services through agencies, organizations, and institutions. So with those being in-kind services, the grant would not afford us that ability to pay everyone, but we do have that support, and I'll yield to Lynn Collins, Director of the Cleveland Treatment Center, to announce the full budget. I believe it was
$11,400.
Oh, what was it?
$11,400.
For the total, for everything?
Well, the total for everything is more like 21.
21. That's what
The
she was
county
trying.
report.
Quick follow-up question. How long is the play?
The play is 1 hour and 15 minutes. We are based on any type of edits and ability to encourage the staff, the acting team, to be proficient with their lines and expedite the presentation with the pacing, able to possibly shorten that, but we're looking at that without an intermission.
If
With
there
an
were-
intermission, we're talking about a 90-minute engagement.
If there was an opportunity for you all to perform this in our Juvenile Justice Center, would that be something you'd be interested in?
Oh, it's definitely an interest, and as well, the impact that this piece can have is the inspiration through the funding we would receive from the county is to try to advance this play to other counties so that we're able to say that Cuyahoga County had an innovative approach to addressing a very serious issue, an issue that brings onto our team members of the Cleveland Police Department, members who are part of the community, as well as those who are understanding of some of the things that lead to the unfortunate alternative lifestyles that many of our community members have, so that there are counselors who can be engaged with the discussions and the follow-up, potentially with all of the work that the Cleveland Treatment Center with dealing with members of our community who are impacted because of drugs, that we are able to think that the follow-up also involves institutions that are training future psychologists, psychiatrists, social workers, and those including the public service and the status that you hold as elected officials.
Also, we've been at the Detention Center Project Safe. It's a Cleveland Treatment Center outreach program. A couple years ago, we had Pastor Sal Perez, who was a gang member, drug trafficking, but he's anointed and he's a gospel singer. He came to the detention center also. A couple weeks ago, we're looking at, but it didn't happen because of logistics. We're a Berkeley School of Music program, one of 41 in the country. And Jelly Roll met with our children.
Martin?
He met with our children. So one of the issues was, because we were small, we was talking to him about me going to the detention center. So he's real connected with us, and maybe that's an opportunity we can afford down the road.
through the chair, and maybe she could offer some assistance as well, maybe we can work that out for you. Okay.
Yeah, Councilwoman was around my line of questioning. So what's the age appropriate for the play?
This is presented as a family piece, however, it does have adult language in it, so there would be a disclaimer at the top of the piece. We're able to negotiate and pull out and edit the language based on the interests of those like you who are invested in the project, and train the actors to deliver the strength of the content of the material so that it can, again, impact the audience for those who are unfortunately in the alternative lifestyles and see it as a realistic presentation that shows that when this piece was produced originally in 1990, that unfortunately we face the same problems and challenges. And other than saying in the piece, if we were to update it, that we would need to change the reference to food stamps to the debit card.
SNAP
And
benefits.
so many other things are still so very appropriate. We were thinking about updating it, but I think it's very important for us to maintain the integrity of the piece representing the 1980s, when our communities were impacted in such a great way with the challenge and the crises of the drugs that then led to greater gang activity in our area, Cuyahoga County, and the city of Cleveland.
And maybe, I don't know what the plan is, but maybe wherever the venue is, have someone such as yourself or someone else restate those words right before the play.
Definitely, with
that
the
would be-
opportunity for pre and post discussions and the great visibility that you would receive. And again, with my 27, 30, 35 years, 31 years of marriage to my lovely wife, who was very active in the community with organizations that can be involved, we intend to say that this effort will add to Cuyahoga County and Cleveland becoming recognized as an edutainment mecca for the nation.
And how long does it take to prepare? How long did it take you to prepare just for these shows here at Mount Sinai Church?
We will start the rehearsals prayerfully tonight, and in terms of advancing them at the church, we have had a team of individuals who were involved with the previous production, Eighth Day of the Week, which dealt with Alzheimer's in the Black community, that have agreed to be supportive of us, as well as a full team that extended to members who were employed with Benjamin Rose Institute, who are even offering us rehearsal space there. It takes a month with trained actors. However, we are looking at the opportunity of giving some people a chance to enter our field and our profession, to work with the professionals that would be hired through the resources that you're affording us, if that is made possible. Thank you.
At least a month. And are they gonna, when you go to Karamu House, there's, what do you call that? All the stage props and all that. Is this play gonna have all that?
That is included as part of the grant proposal, where the stage set is intended to be a rented set based on furniture. However, to try to give the look of the 1980s and the condition of poverty that the family that's portrayed in the piece faces, it's likely that we will be able to acquire some of the items from some of the used store venues, as well as possibly the Salvation Army or some of the thrift stores that offer those items. But my wife would love to get some of the props and set out of my garage that allows us to do performances.
I might can donate a few of those.
And then possibly talk to great community members like yourself, ma'am.
All right. Any other questions from my colleagues? Councilman Sweeney?
On a smart aleck note, through the chair, Peter Lawson Jones? Tell me about that. He's a singer now too, besides an actor?
Yes.
Peter's on this CD.
Actually, it's a really big, excuse me, he did, I'm sorry. He covered James Brown's song, King Heroin. Because like I said before, we're a treatment center. It's doing really big in Chicago, Detroit, and down south, the video is.
He was a big shot before this. Now I don't know if he'll even talk to me again.
Oh, he also did a play with us, Incognito,
Yeah.
which is a New York Times bestseller graphic novel. He also did The Bluesman, which is a New York Times bestselling graphic novel, and a Ted Ginn play also.
Well, thank you. Tell Mike, gave him a shout out.
Okay. And one, he just covered Man in Black. What's the song called? Johnny Cash song, Hurt. He just went to the studio and recorded that too, because it also deals with heroin and recovery.
I'm a Peter Lawson Jones fan, and please tell my side I look forward to seeing him. Thank you, Madam Chair.
Thanks, I forgot about these. Yeah, you made me hungry with the fried potatoes and onions. I haven't ate lunch yet, and I was like,
You got a Dale Miller.
right.
The CDs are passed out with Narcan kits.
These are passed out with?
Narcan kits.
Oh, okay, that's
We'll do that
cool.
also at the production too.
In terms of the flyer that was presented as well, is that, so we can put this out on our little web page or whatever, and I know you said you wanted to have a specific community involved. When we pass these out, they just call the number and is that how they get a seat?
Yes. Can you give us a week to update it?
Okay.
Okay, thank you.
Okay, I wanted to know the timing on that, all right. So you'll tell Sweeney, and Sweeney will let us know when we can start to advertise for that. I do like the councilwoman's direction in terms of, it's always my mindset, who are we really trying to focus, and it's always the children, you know.
And if
They're
I
the
can
one.
share as well quickly, when it was produced at Grafton Correctional Institution, all of those who were incarcerated were the ones who actually built a set. They built a set out of cardboard. They performed all the male roles, and there are 2 female roles in the piece that we brought in those actors to play the female roles with a 2.5-hour rehearsal between the actual actors, actresses, I say actors to represent actresses as well, who came in to give that presentation. And the inmates there were impacted in an immense way. And I definitely know that our young people need to see this type of an address and then give them a chance to see their own family on the stage, to be able to say, that was my brother, that was my sister who was pregnant, that was my mother who was stressed out of working different jobs and being on welfare. And I'm glad to see someone represent their story, even though I'm in that circumstance that I face at this time. Thank you, ma'am.
Not giving away the ending or anything, is there some positiveness that comes out at the end?
Positiveness was established with the talkback, which is definitely part of the presentation, so that the dramatic presentation of the trauma that is experienced on stage allows us to bring all of the actors back on stage unharmed, other than, unfortunately, the loss of the teenager's child because of the trauma involved with a drive-by shooting. And those actors come back in character, and they're able to talk back to the audience as their character. That's what we're trying to groom them on at this time.
Definitely, please leave your card with the clerk, and I can follow up on my colleague's suggestion. Councilman Miller?
So with the performance dates of December 2nd and December 3rd, that means that you have to start practice and preparation within the next couple days. Is that correct?
That is correct. Again, the interest of advancing with this piece allows us to think that there are some other cities that we are looking at. So the team is assembled and already preparing, and it would be a matter of them preparing specifically for the performance at Mount Sinai Friendship United that we are engaged with through this grant proposal.
And with passage not expected until November 28th, are you able to front the necessary expenses until you get reimbursed from the
Yes, we
grant?
are.
All right. Any other questions, comments? Anything else you gentlemen would like to share?
Just wanting to thank you all for the time that you have serviced our community and giving us a chance to feel that our area is making this area the comeback city. And I thank you for that, and have so many others, and definitely know that when the audience stands to applaud the piece, they will be applauding your efforts. And I want to thank you for letting me be myself again.
You're awesome, man.
All right, well, we want to thank you, gentlemen, for bringing this to our attention, as well as Councilman Sweeney. I think I can speak for all council that, we all read the newspaper or watch the news, and, we all want to do something. We all want to have a solution. And I say everything that we do and put in place to try to solve the crisis that we all live in is what we need to do. So I think we would all be on board on this once they hear about it. So thank you for bringing that to us. As I stated, 3 readings, so
I'd like to
can
make
I
a
have a
motion.
motion? Thank you.
Second.
Okay, it's been moved by Sweeney, seconded by Turner. All in favor to move this to the full council under second reading, please say aye.
Aye.
Right,
I'd
thank
like
you.
to add my
Thank you very
name
much.
through the chair.
Okay, Madam Clerk, Turner, Sweeney, Miller, Conwell.
And Simon. It's a good one.
All right,
It's a
it's a
good
good one.
one.
All right, I trust you. All right, I'm going to add my name, gentlemen, to the.
All right.
And for the record, Councilwoman Simon has joined the meeting.
All right. The next item into the record, please.
Resolution 2023-0298, awarding a total sum not to exceed $50,000 to Neighborhood Healthcare Incorporated, doing business as Neighborhood Family Practice, for the Increasing Access to Healthcare for Underserved Populations project from the District 3 ARPA Community Grant Fund.
Good afternoon. Please state your name for the record.
Good afternoon, Dominic Hobson.
Dominic,
Dominic
what's the last name?
Hobson.
Hobson. Okay.
So good afternoon, Chairman Conwell and members of the committee. My name is Dominic Hobson. As I shared, I have the pleasure of serving as the president and CEO of Neighborhood Family Practice. I am a transplant here in Cleveland. I've been in town for 1.5 years now and came here for this role, having previously served and led another federally qualified health center in Cincinnati, where I served as the Assistant Health Commissioner for the city and oversaw that public health center there. So I'm excited to be in Cleveland and excited to share a little about the project that we have, and looking forward to answering any questions that you all have about it. So Neighborhood Family Practice has been around since 1980. We're one of, I think, a total of 6 federally qualified health centers across the county, I would say, but we are the primarily only one on the west side that has a foundation of primary care services. We're all the FQHCs are very unique in nature, but the foundation of who we are is that we serve anyone regardless of their ability to pay. So the programs were created in 1965 under the war against poverty, with the focus on serving underserved communities with high quality and high value care for us, which is a part of our mission, which is a trusted partner in the community. We currently operate 8 locations across Cleveland and Lakewood, with 6 of them being on the west side of Cleveland, and then 2 locations in Lakewood. And in 2022, we served over 21,000 patients across 81,000 visits. The unique thing about our organization, and I'll share a little bit here in a second on our patient mix, is that many of our employees are bilingual, because 25% of our patients speak a primary language other than English, and our patients speak over 59 different languages. So our practice, we provide primary care, behavioral health, including MAT, dental, pharmacy, including clinical pharmacy, HIV services, midwifery and group prenatal care, refugee health services, and financial screening and assistance programs and lab services. The site that I'll get more into the weeds on that we're talking about today will include all of these except for our HIV and our midwifery services. Those are co-located at one of our locations in another location, but our patients have access to those, and we do provide transportation for patients to get there that will be seen at this site that we're talking about today. I do want to highlight the fact the Refugee Health Services Neighborhood Family Practice is the primary screener for refugees and newcomers that arrive in Cuyahoga County. And we have that recognition by the Ohio Department of Jobs and Family Services. And what we're grateful for is that many of our newcomers who are screened by us for that health screening decide to get their care from us. And we've seen that percentage ranges over the years, but it goes anywhere from 30 to up to 40% of those individuals when they are screened, they decide to make us their medical home. And in fact, right now, of that 21,000 patients that we serve, 13% of them are former refugees or newcomers. So it just speaks to the quality of care and how we're welcoming and treating them when they arrive with us. And many of those patients are being served at this site that we're talking about today. So those health screenings are performed at a central location at our Ridge Road Health Center, but many of them are then choosing to get their care at this location based on the availability of housing and affordability in the neighborhood and district that we're talking about today. So we are looking to move a health center from 11709 Lorraine Avenue, which is on Lorraine and 117th, and we're looking to go to 130th and Lorraine. So you see here our current location, and it's been great to us, but we've been at capacity for many years now, not been able to expand and see more patients, and it's just been very challenging for us. It's less than 5,000 square foot. We only have 10 parking spaces. You can imagine we have over 10 employees there, so our employees are parking across the street at Rite Aids and other stores, and they're walking over to be seen, to see the patients there. And then even with the patients that are served, is many times not enough parking for our patients. We do have 7 exam rooms there and then 1 behavioral health office. The location that we're moving to is a former CVS. As I've shared, it's on Lorraine, on the corner of Lorraine and West 130th. We'll be expanding to over 10,000 square foot, adding 57 parking spaces. So we'll have plenty for both our employees and our patients, ending up with 12 exam rooms, another behavioral health office, and then 8 dental operatories. So we currently operate dental at another location where we have 3 dental operatories, and there's a wait list of those services. So by relocating those services to this site, we're able to expand that to 8 operatories and be much more efficient, add staff, and then add resources and care for our patients. And lastly, we'll be able to add a 3rd pharmacy for our organization that will have a drive-up window. This is just a quick view. I won't spend too much time on here, but welcome to invite any of our council members out to walk through the site and share it. But this is our current draft of our architectural plans, and we're currently in that phase of this project that we're working with an architect to draft and prepare these plans for us. From a timeline, so our board approved us to sign a 35-year lease in August of 2023. We were hoping to purchase the building, but there are some out-of-town owners that were not willing to sell. But we did make sure that we had a long enough lease that we weren't worried about the building changing hands on us. Additionally, we do have the right of first refusal should they look to sell the property. We're hoping to begin construction in January of next year with the open for our primary care, behavioral health, and dental services in August or September of 2024. Pharmacy will join later, and that's based on just the requirements that it comes with opening a pharmacy. The timeline is a little bit longer, so we're looking at June of 2025 for the pharmacy services. And you can see here that our lease payments will begin in September unless we are able to open in August, and then we'll start those lease payments a little bit earlier than that. So here, the total project cost is $1.8 million. We did, and that includes, you know, in all of our expected expenses here that are on this slide, we did get some tenant improvement from our owner, and NFP did receive capital ARPA dollars from our federal partners, the Health Resources and Services Administration, that we committed to this project. We also had our recent fundraiser a few weeks ago. We were able to raise almost $30,000 that we are contributing to this project, and we were recently notified by Delta Dental Foundation that they are awarding us over $150,000 to pay for our dental operatories that I mentioned, that we're going to have 8 of them. So they're paying for 5 of those operatories with that funding. As far as the pending funding, of course, we're here to talk about $50,000 today. We have also submitted a loan to the Economic Development Department for the county, and we're hoping for up to $700,000 at a 3% interest rate. So a small correction there. I had 3.5% on that slide. That should be 3%. The other funding that we are pursuing is we've been in discussion with our council member that oversees this ward, and we're asking for a $200,000 grant from them. And then we also made an outreach to both foundations that I have listed here, and our plans are to ask them for $100,000 each. And the remaining funding gap there, we're hoping to raise additional money through foundations, corporations, and individual donors. I will say that the loan that we have applied for, we're hoping that that's going to be a last resort. As a nonprofit organization providing care to underinsured populations, any money that we can get through a grant and not have to pay back allows us to put those dollars back into our organization and expand the services that we provide to our patients. Community impact. So NFP has a very rich history of providing high-value health care. And we're intentional about using the term high value instead of high quality, because our care is high quality, but it's also accessible, it's affordable, and it's also patient-centered. This organization and this site, that we are talking about today, again, has been at capacity for a long time. And we've struggled to make sure that we can see our patients timely. We don't have enough medical exam rooms, and at our other location, we don't have enough dental exam room. So moving into this location will allow us to really meet that need. Additionally, of course, we're going to be able to add parking, see more behavioral health patients, and really meet the need for all of our patients who are struggling with Medicaid and all of the social drivers that come with navigating poverty. One key thing that I want to make sure to note is that this area, or just the West Side in general, we've lost 2 pharmacies in the last 12 months. 2 CVSs have closed. And then if you all follow the news, we know that Rite Aid is currently in bankruptcy court, and they have a couple locations in this area. So, you know, we've had areas across the city where we used to have a wealth of pharmacy services, and if things keep trending in the way they are, we're not going to have enough. So for us, we're very excited to be able to fill that gap and be able to bring some pharmacy service back to this district and to that neighborhood. I do want to share the impact. So in fiscal year 2023, we're going to see around over 2,700 patients at this site across 5,800 visits. So with this expansion to this new location, we're going to be able to expand that by 36% as far as our patients that we're serving, and we'll see over 3,700 patients, or projecting to see over 3,700 patients. And then we'll be able to expand our primary care and behavioral health services by over 60% by going to this new location. So we're projecting to go from over 5,800 medical and behavioral health visits to over 9,000 combined medical and behavioral health visits, and then adding 7,500 dental visits to the site. From a staffing perspective, we will retain 16 full FTE that are already currently staffed within our organization, and we plan to add 13 new FTE. And by year 3, we'll have all 13 of those FTEs on hand, and our total payroll costs will increase to $2.1 million once we've hired all of those employees. And those are a range of pharmacists, pharmacy techs, medical assistants, medical providers, and dental hygienists and other dental employees will make up that 13 new FTE that we're adding. So I will stop there and turn things back over to you, Chairwoman, and thank you all so much for allowing me to present on this project.
All right, thank you, Mr. Hobson. I had a couple of questions. When you, I'm on your third slide. When you talk about, when you have the bullet points under our practice, the midwifery and group prenatal care, do you currently or have any plans to work with Birthing Beautiful?
We do. We work with them right now. We refer our patients to them for doula services. Have a great relationship with Jasmine Long. She's in my Leadership Cleveland class right now, and she's been a huge supporter of mine since I've arrived in Cleveland. And they're an amazing organization that does great work, but we do partner with them and refer our patients to them.
All right, very good. Second question, I don't know what page this is, but the one where you had the current location and the new location. Looking at, I'm not sort of familiar with Lorraine Avenue, but there seems to be a large gap in location from each site. So from the 117th, what is kind of over there to fill kind of that gap for those that can't get on the bus and get up to 130th?
It's 0.6 miles.
0.6,
And we've been, again, knowing we've been at capacity, we've been intentional for years, way before I got here, to look at a space that was close by. We found that many of our patients walked to us in that neighborhood, so we wanted to make sure that we were close and proximate for those who are walking or those who are on the bus line and traveling on transit to get to us. So we're 0.6 miles. You know, we'd love to be a little bit closer, but we do offer transportation services, and we try to do the best we can to reduce that transportation gap for those patients who are moving over for us.
Very good. Open it up to my Councilman Miller.
So besides this location, where's the other CVS that closed?
Great question. Sounds like it's off of Madison and 85th.
And 85th, okay. So I just would like to commend you for this excellent project. There's just such a need for affordable health care out there, and it's just a growing problem. I know that you have an office around West 145th and Puritas, which is in my district. How well is that site working for you?
Thanks for the question, Council Member. It's working great. We just added a new medical provider there. As I'm sure you know, we opened the pharmacy there within the last few years, and that pharmacy is at capacity, and we are delivering prescriptions out of that pharmacy across the city to a number of different zip codes to make it easy for our patients who can't come in to get the prescription from us. But the site is going great. The community is very supportive there, and things are going well.
I think that site is less than 2 miles from this new site that you're proposing. Is there any concern that they're too close and that it's gonna be duplicative, or do you think that they're gonna serve basically different populations?
Yeah, thanks again for the question. 2 miles seems close, but for our patients who struggle with transportation and food insecurity and a number of other challenges, that 2 miles might as well be 20. You know, again, we're moving 0.6 miles from our current location. We don't think it'll have an impact or that will cannibalize any patients from that other location. There is more than enough need. In fact, there's more need than we can serve. And that's the reason why we're trying to expand, and we're hoping to do more outreach and engage the community more to get in and bring in patients who are not currently activated or interacting with any of our health care across the county.
And Where are the site locations in Lakewood?
We are on Madison, not too far from West 117th. And we have a limited day and time location at the Westerly, or the also known as the Barton Senior Center on Detroit.
Okay, good. Okay, so you have 3 locations in my district, so that's pretty substantial. Thank you.
Mr. Hobson, for the services or labs that can't be done in-house with neighborhood family practice, who do you refer the patients to?
We have great partners with a number of different community organizations, but especially our hospital systems, both the Cleveland Clinic and Metro, especially a limited partnership with UH because there's not as much overlap when it comes to our patients in our service area. But we have a great relationships with both hospital systems. In fact, our midwives deliver or support mothers who are delivering out of Fairview Hospital at Cleveland Clinic. And then many of our patients referred and shared with Metro as well.
Okay, thank you. Councilman Sweeney.
Thank you, Madam Chairwoman, my colleagues. Mr. CEO, it's nice seeing you again. I'm so glad that Cincinnati didn't slap the franchise tag on you and we were able to steal you. My attempt at humor. And I'm true, though, because from the day I met you, true professional, and you care. And the whole team cares. I met him upstairs and we went to the Circle conference room. I'm very familiar. It's my neighborhood. And when you said through the chair, at capacity, that's a lie. You were busting out at the seams, over capacity. I got my COVID test in the parking lot with a doctor, snowing out. I mean, they just care like no one's business. And this is absolutely necessary. And it's not just the care through the chair. I'd say 80% of this is the care and the services you provide. But there's a 20% economic development. And that's CVS. When I started in 1997, that was an old Cleveland Trust. They made it a CVS. I was there to help enhance them. They lasted 25 years, and that building's empty again. Maybe 20 years, because it's been empty for a while. And 35 years is going to be wonderful for you. And the one thing that I kind of have learned over the last 3 years is operations like this, they have to come in big. It just makes me feel not good, because I call it God's work, right? You're doing it to help the least of us. And this is a small, 50,000. And then as the time goes on with the city and county, as it moves forward, let's see where it ends up. And I want to thank the administration because their current loan percentage right now, I think it's 5 or 5.5. To offer the 3 is, it's not substantial because it's not a grant, but it's helping with your math. So the administration started at 5, and then we started talking about it, and they realized the value of this. So that's just my little soapbox, and I can't thank you enough. And not only as a council person, but as a person that uses the facility and a person that's in his neighborhood, I can't thank you enough. And don't be shy to, after this goes, as you run your day-to-day operation, you got a council person here and a council person there and all the way around that want to help you. So thank you.
Councilwoman Turner.
Thank you, through the chair. Hello, and welcome to the land. I'm sad I haven't had an opportunity to get to meet you yet, but I see they've been hiding you out on the west side. No, welcome. Quick question for you. Is this money being used on construction or on healthcare services? And can you talk a little bit about any wraparound services that you provide for the refugee community that you serve? You mentioned there's a lot of diversity in terms of the folks that you serve.
Thank you for the question, Councilwoman. And I also hate that we haven't gotten to meet, but I will say that we are just finished our strategic plan, and a part of that is looking broadly across the need across the city. We've shown that we respond well and leverage dollars that we receive, and our outcomes are much better than our peers and comparable to the hospital systems, and the data shows that. But for that question, we have a number of different services that we support our refugees with. We have cultural health navigators that speak many of the languages that our refugees speak. So when they come here, they're greeted by someone from their country, and many times, many of our employees are former refugees themselves. Some of them, NFP, Neighborhood Family Practice, or Neighborhood Healthcare, was their first job when they arrived here, and they've been with us the entire time. But so a part of the wraparound services in our care team, there is a clinical lead, a physician that oversees that team. There is a coordinator of care that works with our resettlement agencies who are working and supporting with housing, employment, and things of that nature. And then we're meeting the healthcare need and making sure they're getting referred to Metro or Cleveland Clinic for those specialty services that we don't offer. But we try to make sure that we are the glue for that team. Unfortunately, for many of our refugees, some of those services that they receive expire at around a 6-month or a year time period. And you can imagine coming to a new country, you don't speak the language, you need those services longer. So we found ourselves filling in to meet some of that gap and trying to do the best we can to fill the need for those individuals once they lose some of those other benefits. But we have some great partners in the community that are supporting and trying to make this as welcoming and inviting and a positive experience as possible for them. And I think it's something that we've done a great job at over the years.
Thank you. Are there any other questions? Any other comments you'd like to share? I think project is most needed, as Councilman Miller stated, healthcare and access to healthcare. I like that you're not really moving that far from the community that you already serve. You're just expanding to be inclusive of more individuals. So as I stated earlier, this will move to the full council for second reading. So can I have a motion, please?
So moved.
Second.
Madam Chair,
Yes, Councilman.
I have a couple more questions, if that would be allowed.
All right, so
We're almost out.
I'll just say it's been moved by Sweeney and seconded by Turner, so we won't have to do that part, and we'll turn it over to you, Councilman Miller.
So I just wanted to know a little bit about the patient mix. Is it only people on low to moderate income, or are there people on higher income that receive services and self-pay? How does this work?
Our overall patient mix for the organization is around 60% Medicaid, around 8% are uninsured, maybe 10% are Medicare, and then the remaining percentage, it ranges around 25% are commercially insured. And that's something that we're very proud of. Unfortunately, many of our uninsured patients don't really have access because they don't have choice. Many of them can only come to us for care. Our Medicaid patients, unfortunately, they're in the same situation at times because it's hard for them to get into specialty care, or primary care providers only accept a certain number of Medicaid patients. But for us to have 25% of our patients that are commercially insured, that speaks to the quality that I was talking about earlier, because they can go to the Cleveland Clinic, they can go to UH, they can go to Metro, they can go to any organization across our county, and we have some amazing health care, but they choose to get their health care from us with the insurance that they have. So again, many of our employees get their care from our organization. Myself and many of the people that are here with me, their primary care providers are at NFP, but that's something that we're very proud of.
Okay, thank you very much.
This item has been moved and seconded. All in favor to move this to the full council under second reading, please say aye.
Hi.
Thank you. Madam Clerk, if you could read the next item into the record, please.
Resolution 2023-0302, awarding a total sum not to exceed $10,000 to the Community Partnership on Aging for the Safe at Home program from the District 11 ARPA Community Grant Fund.
Good afternoon. My name is Wendy Albin Satin. I'm the director of the Community Partnership on Aging.
And hello, I'm Therese Greta. I'm the development coordinator for Community Partnership on Aging.
I'm sorry, I'm slow at writing. Okay, that was Wendy Albert.
Albin Satin, like the
Satin.
fabric, but 2 T's.
Okay, and your name again?
Therese, Therese. and the last name is Grida, Grida.
Thank you. Welcome.
Thank you. So, Councilwoman Conwell, members of the committee, Councilwoman Simon, good afternoon to you all. For 45 years, the Community Partnership on Aging has provided resources and services to ensure that older adults thrive in place, are safe and secure, and remain active and engaged. We appreciate this opportunity to share our plans for a comprehensive fall prevention program and to explain how ARPA funds will help us succeed. The Community Partnership on Aging, or CPA, is a model of municipal cooperation. 6 cities collaborate to ensure that the older residents of the member cities have access to the supports and resources that they need and want. The mayors of the 6 cities comprise the Council of Government, which is our governing board. CPA started out in 1978 with 3 original cities, South Euclid, Lyndhurst, and Highland Heights. Over the years, 3 more cities joined, Mayfield Heights, Mayfield Village, and most recently, Richmond Heights. As you can see through the years, CPA has recognized the changing needs of older adults and continually evolves to meet those needs, whether it's food insecurity, isolation, a pandemic, or technology information, the list goes on and on. A little bit about CPA. In 2022, our social workers counseled 619 residents of our member cities and fielded thousands of phone calls and referrals from community partners like Hillcrest Hospital, Area First Responders, and United Way's 211. We provided over 26,000 congregate and frozen meals, distributed over 77,000 pounds of produce and shelf-stable food, and provided 7,600 one-way rides. This is while we were closed for actually 2 months in 2022. We are well underway to exceed those numbers this year as we slowly return to pre-COVID levels of activity. We offer a wide range of programs and classes from chair yoga to cardio drumming and everything in between, and that are open to all residents of Cuyahoga County thanks to our funding from the county and the Department of Senior and Adult Services. We also coordinate community volunteers. We're right now doing leaf raking for about 100 older adults. We offer homemaking, and we create many opportunities for socialization. We are unique because we don't have a senior center. We work out of the community centers in each city, so we bring the services to the residents themselves. Now, at this point, I want to move into our safety efforts and highlight our Safe at Home program, which provides safety modifications to low-income homeowners in the 6 member cities at no cost to them. Average price per job is $225. This may be exterior or interior handrails, grab bars, realigning thresholds, temporary lighting, things like that. As falls become more of a concern with our aging population, we are now focusing on this issue to create interventions that will impact the risk faced by many of our participants. As you can see here, falls are expensive, both in cost to the state, the county, and our cities, and as well as altering the quality of life for older adults. We are looking at creating a wraparound initiative that will incorporate multiple aspects of fall prevention, including psychological, physical, social, and educational elements. We know that adults with the greatest risk of falling are also the ones with the greatest resistance to interference because they're afraid that they're going to lose their home or they're going to lose their independence. So we're trying to, we developed this strategy to break down barriers to noncompliance and increase the likelihood of positive behavior. So this is a representation of our strategy. At the top of the slide, you see the Safe at Home program, which we just discussed. Moving clockwise, we have a social work team that performs an assessment on every client in the program, which creates a snapshot of a person's condition. including identifying challenges that may contribute to falls, like medical interactions, depression, frailty, and food insecurity. Our social work team will be a point of referral to the program. Plus, they connect clients to other resources that will help, whatever their situation might be. Next, we have classes that will address balance and fitness and fall prevention. These will be available to anyone over 60 in the county who wishes to attend. We are looking to run at least 8 classes over the year. Next is a collaboration with CSU's occupational therapy graduate students. Those students will be teaching our clients how to appropriately use all the safety interventions that we're putting into their homes, as well as other skills like getting in and out of a car or a bathtub safely without falling. Moving around the circle, we have a working partnership with the fire departments of our 6 cities, and this will be expanded. The fire departments will be critical sources of clients. As you know, most cities run many, many lift assist calls for when an older person has fallen and needs help getting up. They don't want transport to the hospital. They don't want any medical intervention. They just need somebody to pick them up. We hope to work with these callers, as many of them as we can, to reduce their risk of falls, reduce the number of lift assist calls that they make to the departments, and save the city fire departments money and staff power. And then finally, we have our peer liaison volunteer program, where we will be convening a group of older adults who are volunteering to be trained to coach, reinforce, and teach fall prevention strategies to their peers. They will bridge the fire departments and the social work team. ARPA funds will be used to secure a fall prevention specialist who will manage, measure, and monitor the 6 elements of our initiative. Community impact includes the lift assist calls that we talked about earlier. If you multiply an average of 15 lift assist calls a month by 6 cities, by 12 months, we can be looking at upwards of 1,000 referrals to our program. In addition, our Safe at Home program averages about 50 residents a year for installations. We received funding from Western Reserve Area Agency on Aging that will allow us to increase to 200 clients in a year. We've worked on a timeline. We're ready to begin right now in November to recruit our volunteers. We've already been advertising for our volunteer liaisons. Plus, we are ready to start the process to advertise for the specialist, for the falls prevention specialist. And then moving through, we start with our students in January. We have another graduate student working on training, and so on. You can see through the calendar. The funding that we have secured already is from the Ohio Injury Prevention Program, OIPP. That is for faculty oversight of the graduate students and the creation of safety kits. From Legacy Village Community Fund, we have received, again, for faculty oversight and implementation of the classes that are called evidence-based classes because they have proven outcomes that are positive. And then we are ready to receive the Western Reserve Area Agency on Aging funds. That is monies that are only for equipment or materials like ADA compliant toilets that are raised a little higher, ramps, and walk-in showers, and the contractor fees. It's all pass-through money. We don't receive any operations from that. The ARPA funds and NOPEC fund are pending, and those are basically for the specialist to manage the program. And NOPEC funds also have a portion in them for administrative costs like marketing and printing, mailing, things like that. So I appreciate the opportunity to share our program with you. I appreciate the support from council, and I am ready for questions if you have any.
Councilwoman Simon.
I just want to say thank you for bringing this to us, and hopefully this can model other communities off of this, because it's certainly a need and impacts the cities and their budget and all of that. So I appreciate what you brought here. And what would this allocation do specifically?
The allocation specifically will be a portion of the specialists fund, of the job creation for the specialists.
Is salary or?
Salary
Toward that for the first year?
for the first year, and then we will continue to seek funding for the salary as we continue
So
on.
they'll establish this program, help
It's,
get
it's,
it.
it's,
That's
it's right, it's a pilot right now.
okay. Thank you.
Councilman Miller, then Sweeney.
Madam Chair, to the presenters, thank you very much for coming in and for this excellent work. And my question is, what kind of things are taught at the falls prevention classes?
Excellent question. Do you want to answer?
So one of the more popular classes that's been around is called A Matter of Balance, and these classes are called evidence-based programs because they are proven to reduce falls. So they teach things like how to stand up from a sitting position, how to stand up if you've fallen, how to avoid a fall, how to reduce fall risks around the home, how to do proper exercises and things like that. So it's a sort of a comprehensive fall prevention, but in addition to the other things like the grab bars and all that. So it's multifactorial addition to the fall prevention efforts.
And do you know of similar classes being offered at the senior centers around the county, or is this kind of unique to your program?
No, it's two answers to that question. Yes, it is being offered. Fair Hill Partners offers the class, but we only get one a year. So we are seeking to become certified so that we can offer the class as many times as we want to. So yes, we do Matter of Balance with Fair Hill Partners, but the need is out there. It's so great that we want to increase access for people to be able to take the class.
And it would include the license.
Yeah, we have to purchase a license. That's the cost. And it's out of the University of Wisconsin, I believe.
And are the classes being offered at other senior centers around the county?
Yes.
Okay. Thank you.
All right. Sweeney.
Thank you, Madam Chairwoman. Just want to say thank you. And you heard all the other presentations. I think as a council, we knocked it out of the park with the usefulness of the ARPA funds and the investments we're making here.
Thank you.
And I just want to commend Councilwoman Simon for bringing it to our attention. And it's something that keeps helping.
Yeah, and we're in a world where we're all, the number of older people is growing and growing, and we have to be ready.
Are you?
No,
baby
no,
boomer?
no,
I'm the last
no.
of the baby boomers, man. So.
No. And we're eternal, yes.
And just on the one thing with all the different falls, you teach them how to fall, right? As you're falling, you can do the roll, you can do the this. You don't want to do that.
No, don't, no.
Yeah, because that's, you said everything, but in my own mind, if you're going down, you got a half a second. If you know something, you might do that little
Yeah.
thing.
Exactly.
So my speech on falling is over now. So Madam Chairwoman, thank you, and keep up the great work, ladies.
Thank you.
Does your organization assist with the senior life alerts in any way?
We have a program where we have a discount for them, and we make that available. We can't afford the actual subscription, but we do work with providers for that. So yes.
Okay, so what is there's a subscription cost for each individual? I wonder what that would look like countywide.
That was a good
Finding
question.
out,
I can find
yeah.
out for you.
Thank you. I thank you for coming and sharing your knowledge. Councilwoman Simon or someone asked my other questions already, so they've been asked and answered. But I'm glad you're in partnership with the WRAA. This is awesome.
Yeah.
I wish all of the communities could collab a little bit like that and kind of work and coordinate with WRAA. If you don't have anything else to share, as I stated earlier, you're more than welcome to come back on November 28th and see how the council as a whole moves this. Probably in your favor, but we always need to wait and see, and then you'll be available for questions if they have any. So if someone could make a motion to move this forward.
So moved.
Second?
Okay, moved by Turner, seconded by Miller. All in favor, please say aye.
Aye.
Thank you.
Thank you all very much for your support over the years. So thank you very much.
Thank you.
you.
And thank you, Councilwoman Simon, for bringing this to our attention. If there's no miscellaneous business, there's a lot going on with HHS, like it always is. Think I have anything to share
Madam Chair.
additionally? Yes, Councilman.
I have one item of miscellaneous business, which was that I'd like to have my name added to 298. It's really quite close to my district, and so I'd like to put my name on that. Thank you.
So that's the NFP, and I will definitely add my name to the last one, the 0302,
Turner.
and Turner. No further questions, comments, miscellaneous business. This meeting is adjourned. Thank you.
I objected.